Hello, one and all. Welcome to this interview today, where we have, if I should say, a star amongst us, AML rank number 5, Dr. Sai Venkatesh Namburi. I would like to welcome you for this live interview session on behalf of DocTutorials and team. First of all, before we begin, I must express my congratulations to you. If to begin with, can you tell us how you feel? I think that's a very important thing that you need to record through this interview.
First of all, thank you so much, sir. I'm much obliged taking an interview from you, sir, especially. My name is Sai Venkatesh Namburi. I have done my MBBS from Ashram Medical College, Eluru, which is a private college. Then I have completed my residency, general surgery from Guntur Medical College, which is one of the renowned institute in my state, sir. Then,
Fantastic. So I think you've had a taste of both private as well as uh, government training,
yes,
if I'm correct. Very
yes,
good.
sir.
Fantastic. Go on. Go on.
Then my interest towards breast and endocrine surgery is specifically because I was posted in first unit, sir. My unit has a
Okay.
high exposure to breast and endocrine cases, specifically thyroid cases, sir.
So your
Including both.
interests, so interest in endocrine and breast started right from your post graduation days, right?
Yes, sir. Yes, sir.
From which year, if I may ask?
Most the time from where when I started to assist the case, sir. So prefer accurately to be at the end of my first year of the residency, sir.
Fantastic. So you've almost had about 2 to 3 years of exposure to endocrine. Am I right?
Yes, sir. Yes, sir.
That's great. So, what if I can ask you something? I just wanted to know what really pulled you towards this specialty.
Uh, Specifically saying, sir, to the thyroid cases, sir. The prognosis, the outcome, even though it was malignancy, the prognosis and outcome of the thyroid cases are very much uh, to compare to other malignancy cases. The prognosis was very good, sir. And the life expectancy of the patients were very high. That brought me towards this endocrine surgery, sir.
That is good. That's very true. Got a very good prognosis. Most of our patients do very well. So I think that's something that
Yes, sir.
you've also found attractive for yourself. So, have you had any exposure after your general surgery, or are you just finishing your course and you're sort of getting into preparation straight away, or have you taken some time? You worked somewhere before?
No, sir. Just I got through my residency, then straight away I gave the exam, sir. But I was
That is very good.
little bit oriented
So what kind of
towards, sir.
yeah? Sorry, what you can go ahead, complete your.
I just got through my residency, then some a little brief period of 2 to 3 months, sir. With 2 to 3 months of preparation, I got through this exam, sir.
That is a very very commendable job that you've done. I think two to
Yes, sir.
three months of just completing residency and getting into super specialty training is very difficult. I mean, given our training and our rigorous schedules, so I think
Yes,
you
sir.
must have put in quite a bit of effort into your preparation. So when did you
Yes, sir.
start preparing for your super specialty exams? Did you particularly have INI in mind, or was it flexible? You wanted this particular specialty, so you were looking at either NEET SS or INI. What was your thought process?
I was not having specifically INI in my mind, sir, but I was a bit oriented towards this specialty, be it in endocrine surgery or surgical oncology. So
Okay.
I gave my ETSS exam, but the result was not a bit satisfactory, sir. So I
Okay.
took a little push. Then I got through your videos, sir, in DocTutorials
Okay.
app. Those were to be honest, they gave me a little extra edge and pushed while towards the end of the exam, sir.
So how long have you been actually preparing? You just mentioned that 2 3 months prior only you have completed your course. So from when did you start your preparation? Can you just? I think this is something that a lot of our upcoming aspirants will in the future be looking up at this video and gaining some inspiration from you. So, what kind of time frame did you start your preparation? When did you start, and how did you go about doing your preparation for this exam?
Actually, I started my preparation towards the end of my second year, sir. After completing my peripheral postings and DRP, then towards the commencement of my final year, then I started my preparation, sir. During the residency period, I have gone
Okay,
through like cover to cover of Bailey textbooks, sir, mainly cover to cover
very good. So,
of Bailey textbook.
what all books did you mainly focus on?
Mainly focused on like basics, starting from basics, sir, from Bailey, including images, tables, and everything. Bailey, Saviston, and a few selected topics from short textbooks, sir. Because me being in government college don't have that much time frame to cover all these voluminous things. Selected topics from short, sir. And
Okay,
coming to malignancy part, I was a little bit oriented towards malignancy, sir. So I
okay,
have focused on MD Anderson Surgical Oncology Handbook to cover preferably
okay.
breast and endocrine cases, sir.
So, you went to the select topics from these specialty books.
Yes, sir.
All right. So that's fantastic. So can you tell us how much of time did you were you able to dedicate towards the entrance exam preparation? You know, given that you are also doing your residency,
Yes, sir.
how what were the challenges you faced? Particularly, this is something that's now this is becoming more and more common. People getting into residency, people getting into super specialty. You know, either just once they finish or maybe within a year once they finish their general surgery training, which is quite difficult.
Yes,
So what kind of game plan did you have? How did you prepare? How many hours did you dedicate? uh, and what are the other supplementary things that you mentioned that you read these standard textbooks? Very important that these standard textbooks are read from cover to cover, but what are
yes,
the
sir.
other things that help you prepare for this exam?
Actually, in my final year, at the starting of my final year, sir, I gone through DocTutorials App, sir. The video lectures in the
Okay.
DocTutorials App were very crisp, concise, and to the point, sir. Actually, they were actually my supplementary part of preparation was textbook, sir. My main part of preparation was DocTutorials App, sir.
Okay.
The video
Okay.
lectures covered in those, especially like surgical oncology part, breast and endocrine surgery part were to the course, sir.
Interesting. Okay.
Then once I have gone through the videos, I'll keep that note side by side with the textbook. Then I'll go through the textbook line by line, sir. So the dots which are missing in my notes were little bit content in the textbook part, sir. So once I have completed my textbook, I've got a crisp and concise understanding regarding the topic, sir.
Okay, so you primarily use videos to your advantage during your course, and then added on your notes and other material from the textbook.
Yes, sir.
So that's a very innovative way of I think preparing for the exam, especially if you're kind of doing this along with your course, as and when you are seeing cases, as and when you are reading for your final year exam. I think this is a good strategy that you have employed to tackle this challenge. That studying, along with residency,
Yes, sir.
very commendable job. So, can you tell us how you feel after having cleared this hurdle? I think this is a major hurdle, super specialty.
Yes, sir.
So, how do you feel? I'm sure your family members are and your teachers are extremely happy for you. So, can you
Yes.
just share a bit about how you feel and how your family members are reacting to this big achievement of yours?
They are extremely happy, sir. Me being from the day one, I was oriented towards this part, sir. So they have me seeing that I have cleared the INSS exam and like being placed in an institute of national importance. They were extremely happy, sir. Literally saying, I was not able to express that feeling, sir.
That's fantastic. I'm sure your parents, your teachers are extremely proud of you.
Yes, sir.
Now, we all of us know that the INI exam itself is a bit of a different ball game. Not
Yes,
it's completely different when you compare it to NEET super speciality. So, can you
yes,
give your take on how the exam was, how you tackled the different components of the exam? You can just give a brief overview of your experience with the exam this year.
yes, sir. The theory part was the main constituent, sir, or consisting of 80 marks, and the interview part was 20 marks, sir. Within the theory part, majority chunk was from the core specialty subject, sir. Like 50 to 55 questions were from the core specialty subject, and 25 questions were from the broad specialty, sir. Mainly targeting general surgery part, sir.
So how
Daily
was
first
your
interview.
how difficult or how easy was the special paper or the core specialty that you're talking about in terms of people who are wanting to prepare, how they should approach? Because as you already mentioned, that is the predominant component of the paper. So if somebody
Yes,
does very well in the subject part, in the special paper part, I think they
yes,
would
sir.
automatically end up getting a good score and they'll be able to make it to round two. So
Yes,
what
sir.
is your take on that specialty part?
This INMA session was comparing it to the difficulty scale. It was moderately difficult, sir.
Okay.
They are specifically targeting some codon numbers, genes from the men syndromes, etc. So you need a very crisp understanding regarding the topic, sir.
So I think
So yes, sir.
a lot of very focused questions I think were asked this time.
Yes, sir.
Yeah, sure, sure. Go on, go on.
Majority chunk was from the actually me seeing the previous interviews. They said that majority chunk was from the best, sir, including both benign and malignancy part. But this year I found that majority chunk was from parathyroid and men syndrome, sir.
All right,
Thyroid
all
was
right. So
little bit and yes, sir.
that's something that was different this year. So
Yes,
I
sir.
think it's very difficult to predict. That way, you get a mixture of everything. They usually try and cover everything. I think this
Yes, sir.
time endocrine had a bigger
Endocrine had
component
medium
rather
chunk,
than
sir.
rest
Yes, sir.
alone. Yes, 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 yes. So,
And
so
there were no questions from biostatistics part, sir.
okay, okay, okay.
But
So what about? Yeah,
yes,
yeah.
sir.
Go on, go on.
But
Sorry, go on.
we knowing the thing about biostatistics would give us a edge above others, sir. If at all the questions were asked, better to
Okay,
be prepared, sir.
okay. So how did just wanted to ask you, how did DocTutorials per se help you in that specialty part of the paper? Because I think general part of the paper is something that everybody is able to prepare, and
Yes, sir.
as you already mentioned, specialty part is what makes the real difference for uh, making a top score and really being among the top rank, so that gives you an advantage when you go for your interview also, because the examiners do have your theory marks, they know how you've done. So
Yes,
how
sir.
did doc tutorials and how did the app really help you in making that difference from the others?
The video lectures in the app were very crisp, sir. They were mainly focusing on from Sebastian part, sir. But once I came through your lecture, sir, in the test and discussion part, you covered that thyroid part, parathyroid, and adrenals part, sir. Adrenals and men. Then I literally fell in love with your the way you are approaching the question, the way you are approaching the problem. So I thought whether, sir, I was literally like seeing app daily, but whether whenever your videos about endocrine surgery being updated in the app, sir. Then once my INSS that notification got announced, then I went to the specialty part of the DocTutorials app. Then I came across your lecture, sir.
Okay,
Then I took a subscription. Then that little extra edge and that extra push propelled me towards the exam, sir. Actually,
great.
me covering entire DocTutorials Bailey Sabation part was Sab Schwartz, MD Anderson was a little bit, was a major chunk. Your videos were the final push. They were like so proud to me, sir, in the final part.
Great, great, fantastic. So, can you tell us a little bit about how the second part of the process was? I think that is
Mm.
another major roadblock that a lot of our students find. A lot of
Yes,
people
sir.
clear the theory, but then when it comes to the second round, they do find it a little unpredictable, little they don't know how to approach it. So, can you let us know how you prepared for that? What all you went through and your experience through that second part of the selection process.
Yes, sir. The second part of the selection process was the interview part, sir. Once I cleared the exam, then got preliminarily qualified for the INSS interview part. Then once gone through the breast clinical images, clinical scenarios, management protocols, that like AJCC 8th TNM classifications. Then I was little bit ready for the interview part, sir. Then your interview came, sir. Your mock interview. You took the mock interview about like 3 to 3.5 hours, sir. That helped me a lot, sir. Also, you said about the nipple discharge thing that madam said. The madam has published a paper. Your interview was little bit, not little bit. It was more helpful to me, sir. So once I went to the on the day of interview, I was the last candidate being interviewed, sir, according to roll number wise. So I was little
Okay.
bit tense, but me being the last roll number, but they covered nothing to be tense. They spoke very warm-heartedly. They spoke very soft, and literally they are taken through me, and they are taken through the interview very rightly, sir.
So I think having that kind of confidence must have really helped. Having a
Yes, sir.
practice round, having a kind of uh, dry run of how things might be, what kind of things you can expect. I think that would have really helped you build some confidence and be a little bit more bolder. I'm sure whatever said and done, the entire credit is to you and your hard work and your preparation. But I'm sure some amount of confidence you would have got by going through the interview, going through the mock sessions,
Yes,
and
sir.
gaining some confidence in answering and at least knowing what areas to cover, what to go through before you go. Little bit to know what some important trials. I think that may or may not have
Yes,
been asked, but I think that kind of adds to the confidence that you get.
yes, sir.
So now
That
that
mock interview especially helped me a lot, sir.
very good, very good. Okay, okay.
It boosted my
That's very,
confidence.
very good to hear. Yes.
Yes, sir.
So I think now that you have really gone through this rigorous system of preparing for exams, going through a theory exam, going through a second round of interview. I think
Yes, sir.
now you really deserve uh, a topmost rank that you've got. You've got an AML rank 5. So what plans next? I mean, uh, I'm sure it's difficult. It's a difficult question to answer at this point in time. But
Okay, sir.
what are your future plans, and what how do you look at yourself in the next maybe 5 or 10 years from now?
Uh, I want to excel in the field of endocrine surgery, sir, including thyroid and parathyroid, recent advances, recent techniques, recent management protocols. Be entirely confident about the endocrine surgery, sir. So I was a little bit oriented towards that, sir, specifically. So I wish to
So are you
continue
more
in the.
interested in breast, or are you interested in endocrine, or do you have a uh, interest in both? Surprisingly, you will find a lot of aspirants. Some of them, most of them, interested in breast. The
Sir,
endocrine interest may be a little lesser, but a lot of people will be interested in breast, and that's why they go for this INI MCH breast and endocrine surgery. So, what is your kind of interest into?
actually, I was interested in both of them, sir. Both of them,
Okay,
okay, I'm interested, but I was a little bit biased towards the endocrine part, sir. Specifically, thyroid and
okay,
parathyroid, sir.
all right, all right.
Because the patient outcome was very good. Patient used to come to follow up in my first year. Once the first case of my thyroid case, still I have them in on my follow up and at the completion of my residency, sir. So that gives me immense confidence and boost, sir.
Fantastic. I think that is probably, to be very honest, probably for an endocrine breast surgeon, that is the biggest motivation. I
Yes, sir.
mean, uh, this is something I'm sure you also have gone through this dilemma of why endocrine surgery, why endocrine and breast, why not something else? Because this
Yes, sir.
is, as you all know, this is a relatively newer specialty. I should say
Yes, sir.
relatively, though it's been there in our country
From
for
the
at
past
least
20
20
years,
years
sir.
now.
Yes,
Yes,
sir.
so for the past 20 years, it's been there. Gradually, as you've also noticed, it's becoming more and more established. There's a very good scope in this specialty. So
Yes,
I'm sure you've also gone through that dilemma. And probably, as you rightly said, the biggest inspiration is your good outcomes that you're able to provide to the patient. And of
yes,
course,
sir.
they're good prognosis. So they have lifelong relationships with you. Wherever you go, you're going to take them with you. So that's, I think, the
Yes, sir.
biggest inspiration for you to do this course. Any plans uh, in the future? What kind of practice you want to settle into? What kind of are you into teaching? Are you into more of operating? Are you into research? What is your area of interest in this particular specialty? Because mind you, this is one unique specialty where it gives you equal opportunity for everything. It gives you good opportunity for teaching. It gives you good opportunity for operating. It gives you good, fantastic opportunity for research. It's a very exciting specialty. So, what is your area of interest, especially now that you're going into a institute of national importance, which is renowned for its research, renowned for its publication? I'm sure this is going to be a very enriching experience for you. So, what is your take on that?
Actually, I was not more into academic activity, sir. No. Like I was into academic activity, but more oriented towards surgery and patient follow-up, sir. Surgery intrigues me more, sir. So the way I do surgery, the way patient come to me for follow-up, asking where is this specific doctor, where is this specific doctor, I want to speak with him. That gives me more like confidence and boost, sir. So I was more into this thing, sir.
So I think now that you're moving on to this next phase of your life, especially in a premier institute like this is something that probably you're going to get a good exposure to, more of a little bit of more of academics, a little bit more of publications, conferences. So I think that is an exciting journey that's going to open out the other dimension of endocrine breast surgery to you.
Yes, sir.
Is there any advice that you would like to give for our future aspirants um, for endocrine breast surgery, especially for the INI exam? Any advice that you would like to offer to them?
Actually, textbook must be the sole part of your preparation, sole component of preparation, sir. DocTutorials, be it any app, DocTutorials or any platform, that must be supplementary, sir. Me being first going through the video lectures, just it gives me a broad overview over the topic. Then me reading the textbook from line to line, cover to cover, including every image, every codon number, every table. That gives me crisp and concise understanding regarding the topic, and it gives me immense boost while answering the question, sir. So, core textbook must be the sole part of your preparation, sir.
All right.
And you must go through a specialty part of these things, sir, while attempting INISS. That immensely boosts your
INISS, you have to have a
way
special
you-
focus on the specialty paper.
Yes, sir.
All right.
Sir.
Dr. Venkatesh, I think we are very proud that you are able to give this excellent rank of AML rank number 5, and
Yes, sir.
I'm very happy and very proud of you. And DocTutorials and team, we are very happy to be able to help you get through this difficult journey. Especially, I'm very happy to know that we were able to help you uh, prepare for the exam over a period of 1 year along with residency. I think
Yes, sir.
in the upcoming future, this is how things are changing now. People are preparing along with their rigorous schedule, and we are very happy that we have made a difference for your preparation. So, all the very best. I must say, welcome to endocrine and breast surgery. Welcome to this exciting field. I hope in the upcoming future, you will be an inspiration to the youngsters who will take up this specialty, and
Yes, sir.
I'm sure there are very bright days ahead for you. Thank you so much
Thank you so much, sir.
for interacting with us today, and all the best. I
Yes, sir.
think it's time to relax, take a break, enjoy before you join into the
Join the institution.
rigors of the course. I'm sure you're going
Yes,
to
sir.
have a excellent 3 years at AIMS, and this is going to be a very fruitful journey. All the best
Sir.
from us. Do stay in touch.
Thank you so much, sir. With you taking the interview of me, that was clearing the exam was one part, sir. Me getting an interview from you, especially, was life changing moment
It's
for
it's
in
our
my life,
pleasure.
sir. Recently,
It's a pleasure to be with you through your journey.
yes, sir. Thank you
Thank you.
so much,
Thank you.
sir. Thank you so much, sir.